Viewers. Today, we're unraveling the mysteries of the clavicle bone. We'll explore its origin, insertion, and function. Location and articulations. The clavicle is located horizontally between the upper part of the sternum and the acromion process of the scapula. It articulates with the sternum medially and the acromion of the scapula laterally. S-shaped structure. The clavicle has a gentle S-shaped curve, which contributes to its strength and ability to transmit forces from the upper limb to the axial skeleton. Attachments. Muscles and ligaments attach to the clavicle, including the sternocleidomastoid, trapezius, deltoid, and pectoralis major muscles. Blood supply. The blood supply to the clavicle comes from branches of the subclavian artery, including the clavicular branch. Venous drainage is through the subclavian vein. Insertion. The clavicle has two main points of insertion. Medial end, sternal end. It articulates with the manubrium of the sternum at the sternoclavicular joint. Lateral end, acromial end. It articulates with the acromion process of the scapula. Sternocleidomastoid muscle. Origin. Sternal head originates from the manubrium of the sternum, and clavicular head originates from the medial third of the clavicle. Insertion. Mastoid process of the temporal bone and the superior nuchal line of the occipital bone. Trapezius muscle. Origin. Upper fibers originate from the posterior aspect of the occipital bone. Middle fibers originate from the spinous processes of C7 to T3 vertebrae. Lower fibers originate from the spinous processes of T4 to T12 vertebrae. Insertion, the lateral third of the clavicle, acromion process, and spine of the scapula. Deltoid muscle. Origin, lateral third of the clavicle, acromion process, and spine of the scapula. Insertion, deltoid tuberosity of the humerus. Pectoralis major muscle. Origin. Clavicular head originates from the medial half of the clavicle. Insertion, lateral lip of the bicipital groove of the humerus. Subclavius muscle. Origin, the junction of the first rib and its costal cartilage. Insertion, inferior surface of the middle one-third of the clavicle. Function. Support and transmit forces. The clavicle acts as a strut, providing support and transmitting forces between the upper limb and the axial skeleton. It helps in maintaining the shoulder's position away from the thoracic cage. Shoulder movement. The clavicle's articulation with the scapula and sternum allows for a wide range of shoulder movements, including flexion, extension, abduction, and adduction. Protection of neurovascular structures. The clavicle helps protect underlying neurovascular structures, such as the subclavian vessels and brachial plexus, which pass beneath it.